The House Families and Veterans Committee will come to order. Would the clerk please take attendance?
Chair Schmaltz.
Here.
Representatives Wozniak.
Here.
Fox.
Present.
Johnson.
Here.
Thompson. Pavlo.
Here.
Wolford.
Present.
Young.
Here.
Burns.
Here.
Reigans. Song.
Online.
Present.
A voice from beyond.
Madam Chair, you have 9 members present, a quorum.
Thank you, Mr. Clerk. Representative Wozniak moves to adopt the minutes of the May 13th meeting without objection, so ordered. Our first order of business is to welcome Brian Philson. He's CEO of Highfields and a close friend. He does tremendous work. He's going to talk about the mission of Highfields and the significance of the work they do to help all of our young people and families. Brian, the floor is yours. Just push the button.
Yeah, thank you, Chair Schmaltz, and thank you, committee. It's good to be here, and I welcome the opportunity. As Chair said, Brian Philson, I am the CEO at Highfields. In July, I will start my 20th year there. Prior to that, I did 21 and a half years in juvenile justice in Jackson County. So 2 weeks ago, I celebrated my 40th year of work in the industry. It's kind of hard to kind of go back and look at 4 decades, and as I embark on this 5th decade, there's been a few things I've seen over the years, and so
Well, congratulations, and thank you for all the work you've done.
yeah, thank you very much. As I said, I began in the juvenile home. It was April 30, 1985, and it was a whole different world then. And the height of juvenile crime actually was 1994. 2 things were occurring in Michigan. It was youth gangs and the crack epidemic. And I was 27 and now running a juvenile home, trying to figure things out. And what I can say is today, juvenile justice, arguably in our country, is at its lowest rates in 40 years. We don't often feel that way, but I applaud the state's effort on juvenile justice reform over the last 4 or 5 years, and I've been a part of that. Personally, I grew up in Branch County, rural Michigan. I call myself a trailer park kid. Once a month, we would make the trip to the government food handouts in Coldwater. I knew what government cheese, powdered milk, and handouts were. They gave peanut butter in these big metal cans. Some of you I see nods of heads. That peanut butter can became my lunch bucket, for many years when I was in elementary school. So some people often ask me, Brian, why did you choose social work? I think my life kind of says it. And if it wasn't for social workers as a rural kid, if it wasn't for CETA, corn detasseling programs, different things, free and reduced lunch, I would not be the same adult that I am today. And having a childhood where things like poverty and divorced parents and a broken home really impacted who I became and my life as a social worker. I served 8 years on the Michigan Board of Social Work, chaired 7 of it. I did 2 stints on the Michigan Committee for Juvenile Justice, have returned, and I'm now serving on that committee. And so sometimes people ask me, why Highfields? Why did you choose Highfields after almost 22 years in juvenile justice? And I often say that I began the first half of my career working with children and teens in the system. This last half of my career has been working to help keep children and families out of the system. And so I really want to kind of talk a little bit about that, how prevention is so important to the work that we do with families and preserving that fabric of providers within the state of Michigan. Highfields began in 1962. Many of you may have heard of it. Some of you may have been to our campus in Onondaga. Judge Robert Drake was a probate judge here in Ingham County in the early 60s. And anytime at that time a young man needed an out-of-home placement, they had to go to Metro Detroit to an out-of-home placement. And Judge Drake said, I want a place here in Ingham County where those young men can go. So he and a group of concerned citizens formed Highfields, and we often say formed by the people, for the people, and that organization still stands today, and I'm proud to be the CEO. So what was founded on a residential program for young men in child welfare and juvenile justice has grown now, and we serve 10 counties. And while we still have that program, that is really our smallest program. The bulk of our work is really done in two other buckets. That's community services, and that would encompass child welfare and children's behavioral mental health. And then the second bucket is in the educational arena. So 3 divisions at Highfields: residential, educational, and community service child welfare. In those child welfare programs, we do a lot of work that we call family preservation. So when a child is at risk of being removed and placed into foster care, somebody calls Child Protective Services, a teacher, a pediatrician, a nurse, a doctor, a neighbor, and they're like, I don't know what's going on in that home, but I'm worried about those children. So DHHS gets involved, and in those counties where we have those programs, they call us up, and then we come alongside that family, and we really do 3 things. We stabilize, we strengthen, and then we go on to empower them. And we make sure that the child's going to be safe. We do everything in our power because we know that ultimately children are best served when they stay in their home. You know, some people might want to argue that, but the reality is children are better when they stay in their home. And if we could find a way to equip, strengthen the parents and the families, that's really the best place for those children. And so that's what we do. And then in our educational programs, we have 5 in Jackson County, 4 in Ingham, and 1 in Eaton. We come alongside elementary and middle school children in after-school programs. We help them get their homework done. We help reduce behavioral issues during the day. We engage the parents to be more engaged with what's going on in the school. We feed them dinner, and then we bus them home. Now, many of us who have had elementary kids, wow, could I get my elementary kids at 6:30, they're fed, their homework is done, and their behavior is better. And we serve 30 kids every day in each of those locations. And we're very excited to continue to do that work. And in our Children's Behavioral Mental Health Division, we get referrals from local mental health providers, and they get children that have some severe issues. Some are on the spectrum. We do autism case management. We work with children in the home-based setting, and that's probably the one thing that sets Highfields apart from other organizations where children and families come to the office and they counsel in an office and then they go home. Our social workers and counselors go into the homes. We sit at the kitchen table. We sit in their living room where, hey, show me your bedroom. You know, where do you do your homework? And we make sure it's a safe environment. We engage them where they're at, and we often say we meet them at their earliest point of need, help them figure out what they need and what they want, and then we help them get there. And we're very proud of the work we do in that home-based setting, and we're very proud of the work that we do in all 3 of those divisions. So I would say programs like Highfields are truly essential to preserve the provider network for children and families. If I were to poll the group and say, what are the needs of children today? What are risk factors? The list would be extensive. And we know what some of them are, you know, poverty, you know, single parent homes, broken families, after effects of the pandemic, you could name it, substance abuse, mental health, the list just goes on. We know if a child isn't reading at 3rd grade level, by 3rd grade, they're 8 times more likely to become a juvenile delinquent. We know if they have a parent or a family member that has previous incarceration, they are more likely to become incarcerated themselves. We know that single parents are at greater risk to having children removed from their home just because of they don't have the help that they need or support. And so we need to do everything we can to preserve the provider network like Highfields that comes alongside to help those children and families. I applaud the state's recent effort around GAJ reform, and we need to continue to do that. I applaud the state's efforts around the Child Welfare State Leadership Team working to establish rates that allow the providers to do the work, but our work's not done. We need to continue to build in cost of living increases and maintain adequate funding for the work we do. Huge battle with potential loss of federal funding and Medicaid. We are under attack. I know you know it. I know you feel it as much as we do that work in the trenches. And I appreciate your work and anything you can do to hold the line on that. A continued effort on preservation is critical. The reality is that every dollar spent in preservation will save a lot of money, particularly around out-of-home placements. And we know that the results are much better when we can do that. Just a recent story or two to kind of highlight the work, and then if we have time, Chair, we could do a little Q&A, but that's up to you. So here's a story of a young single dad here in mid-Michigan. As sometimes late teens, early 20s, they had a baby, and tragically, the mother who had custody lost her life. And there was no extended family for a family placement. This young man in his 20s all of a sudden is awarded custody of a less than 1-year-old. And CPS was called, not because there was neglect, but simply in this case, this young man had no idea how to parent. He too had no family, so they were assigned to Highfields. We came alongside him, had some amazing staff that worked with him, made sure that he knew and had everything from car seats to appropriate beds and a high chair and everything that most of us learned from our own families. And we had people who came alongside us. Because of our family preservation efforts and our ability to help that young man, it's been 2 years, and that 3-year-old is doing amazingly well. And we often cite that as a great success story. Another one I just want to share is a young man named Freva. He was in one of our after-school programs. We first met him as a 5th grader. Interestingly enough, the bus would pick him up at the homeless shelter. His mother and 2 siblings, through a variety of circumstances, had lost their home and were temporarily out of a home and were living at the shelter. The school bus would stop at the shelter, pick he and his 2 siblings up, and transport them to school. They benefited from free and reduced lunch. Freva clearly benefited from an after-school program where he could get his homework done, he could get fed dinner, he could recreate, he learned in a cooking class, all of these kind of life skill building opportunities. And if you were at our last breakfast fundraising in October, you heard Freva tell his story. There wasn't a dry eye in the place. And he came up to me afterwards. He goes, Mr. Philson, or actually he said, Mr. Brian, thank you for giving me the opportunity. Thank you for all you and Highfields do. And that's just kind of one story of the work we do. But those stories are repeated from agency to agency throughout the entire state of Michigan. And so anything that you can do to help preserve that provider network, like Highfields, it is very much appreciated. And I thank you for all you do. I thank you for giving me time today. Thank you, Chair Schmaltz.
Thank you, Brian, for being here, and thank you for all the work you do. You and your staff do a tremendous job, and you help so many people. I love that you focus on family preservation. Mm-hmm. I think that's very important. But as we all know, prevention is key to all of this. So what areas can we do in the aspect of working to prevent some of these problems?
Yeah, one of the number one things is to begin to reduce, we call it risk and protective factors, and the state of Michigan has done a lot of work in this regard. As we look at all of those risk factors that exist in the lives of children and families, anything that we can do to reduce those risks and then provide protective factors. So a protective factor, as an example, an after-school program would be one of those. Two caring adults in the home is a protective factor, whereas a single is a risk factor. Eliminating substance abuse or providing early detection of issues. Coordinated health care and mental health care between pediatricians and mental health providers and schools. The support of school-based mental health is essential. Historically, a school would identify a child or a teen who is depressed or at risk of suicide. They would make a referral, and then they'd say, okay, you got to get yourself to the local mental health organization. And well, a lot can happen, and often those families don't get that teen to where they need to go. Having a mental health program inside the school eliminates that. They just walk down the hall, or the mental health comes to them. So thinking outside the box and understanding that there's different ways to deliver those prevention programs is pretty critical. So thank you.
Thank you. We have some more questions. Representative Wozniak.
Thank you, Madam Chair, and thank you for all the work you're doing. With regard to adolescent addictions, what would be the percentage of the kids that come in that would have an addiction rather than maybe some other mental problem?
Yeah, so interesting, like if you're talking, say, the youth that we work across the board, say in juvenile justice, I would say the majority of our youth come in, there's a greater percentage with a mental health diagnosable disorder than there are with, say, a substance use disorder addiction. Now, that still exists. We know that arguably the two drugs of choice continue to be marijuana and alcohol, but those are often what we call gateway drugs, and they lead to other. And we continue to live in an opioid epidemic where we have prescription drugs. These teens often get them from relatives that don't take good care of them, or grandparents, as crazy as that sounds. And so that's just kind of a quick snapshot at your answer, yeah.
Just shifting the camera a little bit, what about instances of sexual identity, sexual experience in the teens, and how do you work with that?
Yeah, so very clearly, we need to be able to work in all of our programs with those youth that come in identifying as something other than what we might think they are. And we have youth in every program identify in some way as LGBTQI, and so we have to be able. Our residential program, because we're a qualified residential treatment program, that's one of the requirements that we need to be able to respond and to cater to those individual needs.
Has there been an uptick in those?
I think so. I don't have hard facts. My guess is that those amount of youth has always been there. I think there's a greater sense of being able to identify them and call attention and self-identify than there was, say, 10 and 20 years ago. So, yeah.
And your patients are discharged at what age?
Yeah, so it really depends on which program. If we're working with our children in our autism case management program, those are typically elementary kids, and so they're discharged when they're ready to be discharged. That could be a few months, it could be longer. Our residential students typically are coming in anywhere between 13 and 17, and they typically do a 6-month program. Some young men are there more like 8 or 9 months. Yeah.
One more question. How many of your children, percentage-wise, can you estimate come in with anger issues?
A lot. Again, depending on which program, it's a pretty common theme among the young men that come into our residential program. And the reality is many of them have been raised in an environment where anger and/or violence is an acceptable solution to problems. and trying to teach them alternative methods is pretty key. Less across a lot of our other programs. Like most of our elementary and middle school programs, you may get a youth here or there, but it's not a common thread.
Yeah, I would say the earlier we can catch that, the better off we'll be. So, thank you.
Yeah, thank you.
Representative Young?
Thank you, Mr. Bryant.
you.
Appreciate you being here. All the good work. I just want to uplift a couple of things that you said because it's so refreshing to hear statements when you say, make certain that all providers, it's not self-serving. You're not just here talking about just the good work that you all do, but the work that the provider network does for our youth, for our families. And so that's to be commended because we don't necessarily see it all the time because it's hard when you're out fighting for your program, fighting for dollars. So I appreciate that. I heard that. I also want to just thank you for uplifting the importance of providing those free and reduced meals for our young people and being certain that all our young people have some place to go where they can be safe, they can be welcome, and that they can get the care and the resources that they need to strive. So I want to say thank you for that. And then I also want to thank you for identifying, when you're saying reducing risk. So you shared a little bit about that with us, and I really appreciate your in-home model. I wanted to talk about that just a little bit, Madam Chair, just that in-home model, because I feel like when we remove that barrier of transportation,
Right.
where our families have to go someplace to get the help they need, opposed to it coming to us, then we're going to have better outcomes. And I'm wondering if you have any data that supports that. It seems to make sense to me, but I'm really curious about that.
Yeah, so I appreciate that. Thank you for your comments. First, the in-home model, I will say, in the midst of the pandemic, was hard to hire staff who were willing to go into homes. You know, and we felt that. I would say this is the first year where I feel like we're getting employees who are applying for jobs to work the in-home model, because it's taken a couple years for us to recovery. We clearly have data. We're pretty good. I don't have it like right here at my fingertips, but I'd be happy to have conversations with you. Most of our programs check success rate at 3 months, 6 months, and 1 year. And depending on which program, we evaluate outcomes differently. You know, for all of our child welfare program, they need to be in the home and not have needed another out-of-home placement like foster care. That's what we consider that we've preserved the family unit, and that's successful. In most of our JJ programs, we don't want a further felony. We don't want a further incarceration. And we ask that they either be working or in school at 3, 6 in a year. So yeah, I'd be happy to work and get you some of those numbers. That's great, yeah.
Representative Thompson?
Thank you, Madam Chair. Thank you. So I do have 3 questions. The first question involves the juvenile justice programs that you offer. It's my understanding, is this true, that when a child is sentenced to a time frame as if he's charged with a crime as a minor and he gets sentenced to residential placement, that the children are still sitting in like JDF for months, sometimes up to a year at a time, and their sentence does not start until they get to a facility such as yours? Are those the children that you're receiving?
Yeah, so there's a lot of questions in that, Representative Thompson.
That was just one of my 3.
Yeah, so I can say that the state has been in a child care and institution crisis over the last couple of years. More kids have needed placement than have existed, and there's a variety of reasons that go into that. I can say that the state has made, I think, really good efforts and strides in that, and those wait lists are reduced. But I think last week I checked, I think we have 10 youth that are on our waiting list, and so those 10 youth are sitting in JDF, Wayne County, or any other detention center. I do know that some counties that aren't sending their kids through the state system have chosen to send kids out of state because the placement has been so, the wait list has been so long for them to get a placement elsewhere.
Do they have, if they were a minor and they're charged with a crime as a minor and they were sent to residential treatment and they would have to go out of state, does the parents' rights have to be removed? What if a parent opposed them leaving the state for their ability to visit them or have visitation? What would something like that look like?
That would be an individual jurist decision based upon, individual circumstances.
So we just know we have to get more beds here in Michigan.
Yeah, I think that would be one answer. The other would be to, wouldn't it be great if we didn't have a need
yeah.
for beds? I mean, I always say I want to work myself out of a job, but yeah.
And then just if I may, did you say that your facility offers gender-affirming care?
We work as hard as we can to any of the referrals that come to us. Because of where we're located, we're pretty rural. It's hard to access a lot of staff that can support the specific needs, but we have had some youth that I come in that identify others male, and we do everything we can to work with them in that regard, yeah.
And what does that look like with a co-ed situation?
Well, our facility is not co-ed.
Okay. So
Okay.
you're only male?
We are.
Okay.
So you would-
Representative, I'm sorry.
Okay, that's okay.
Okay,
Thank you.
Representative Johnson?
Thank you, Madam Chair. Thank you for your insightful presentation. Thanks, Joseph. With the shortage of help, funds, resources of whatever kind, do you ever find yourself partnering with local churches that already have sort of an outlook and a focus in this direction?
Yeah, thank you, Representative. That's a great question. We actually have a number of, faith organizations that partner quite a bit with us. They tend to like the holidays, for obvious reasons. But we had a church out of Grand Ledge that adopted our entire residential program, and it went beyond, just buying the students gifts. They said, "What are your family's needs?" And we had one young man that lived out of county who needed, bunk beds for his siblings, and they bought bunk beds, transported them, set them up. So we have a number of faith-based organizations that come along. A lot of service clubs. There's a small group of women that are faith-based, and they come alongside us very quietly once a year. And yeah.
I think collaboration is so important with many of our agencies like yours because you can help each other so much and provide so many services for each other. So that's great. Thank you, Brian, for being here. I think if any of us would like to go out there and visit Highfields, I know you'd love to have that happen. So if anybody's interested, let me know. I'd be happy to come out there again. And
Yeah, if I can. We actually, in the desire to expand the beds, the state issued infrastructure grants, and we applied for and received. So our entire administrative and residential treatment hub was renovated through a state, or it's in the midst of being renovated through a state infrastructure grant. We're going to do a dedication in July. I'd be happy to get the committee that date. And
that would be great.
Yeah.
Yes, get me all the information, and
I
we'll
will
make
do
sure
that.
we get out there.
yeah.
Thank you again for being here, and I appreciate everything that you do and your staff does, and we'll talk soon.
Great,
Thanks,
thank
Brian.
you, Chair.
Next, we will have Dr. Mona Hanna, MD, to testify on RX Kids and the significance of providing funding for new mothers to help with expenses of having newborns. Thanks for being here.
All right. Can you guys hear me okay? Awesome. It is wonderful to be here. And thank you for that incredible presentation. I think a lot of what we're going to say is very similar. So I'm a pediatrician. I'm a professor with Michigan State University. I'm the Associate Dean for Public Health. And I'm so excited to talk to you about RX Kids, which is a program that prescribes health, hope, and opportunity across the state. It is evidence-based. It's prevention-driven. It's child-centric. It is super efficient. And it is something that there is not a day that goes by when I don't hear from folks across our great state who say, hey, we want this in our community. So let me tell you what it is, but I want to start with also with a little story. So you guys, I think, all received these packets, And on the front cover is this beautiful baby with the red bow, right? This baby is the cutest baby. This little kiddo, her name is Audrina. And she just came in actually for her 1-year checkup. And she was taking her first steps. I walked into the room and she squealed and I squealed. She fell in her diaper. Thank goodness for diapers, because they kind of buffer all those falls. And I, checked her out. Her growth was good. We gave her vaccines. We checked her development, and everything was perfect. And I got to write in her chart, healthy, thriving baby, this baby Audrina. You just look at her, look at those chubby cheeks, she's beautiful. And this was almost not her story. So let me tell you a little bit about her story and the fact that she wasn't almost a healthy, thriving baby. During the COVID pandemic, her father brought home drugs to the house. Mom got addicted to opioids, couldn't escape the drugs, couldn't escape the house, and lost custody of her 2 older children. So she lost custody of her 2 older kids, and then she got pregnant with this kiddo. And Mom knew that she wanted a better life for this baby. So she moved into a recovery home, and she heard, and this is in the Flint area, and she heard that we were thinking about a program to support moms and babies. This was before ARC's Kids even launched. So this baby's mama, Audrina, her mom Tegan, was part of the planning of ARC's Kids. Because as a community, we wanted to figure out, like, we can do things better. We can keep families together. We can prevent problems. We don't have to spend so much money after the fact treating the consequences of poverty. So her mama was part of the planning of this program. She came to meetings with other pregnant mamas to figure out how we can do better as a community, as a society, to care for each other. Audrina was born in January of 2024 when RX Kids launched initially in Flint, Michigan. And she was one of our first babies. She was actually at our launch when she was just a week old. And what RX Kids provided for her family was the economic stability. So every pregnant mother in an RX Kids community gets $1,500 in mid-pregnancy. And then once a baby's born, it's just $500 a month for either 6 months or 12 months. And what this did for Audrina and her family is it allowed the family to show that they had a little bit of money in the bank account. Mom bought diapers and cribs and car seats, bunk beds, and she eventually got custody back of her 2 older children. So what her mother says to this day is that this program made my family whole again. When we think about child welfare, it is one of the biggest kind of cost items in our state budget and in our federal budget. The peak age of child welfare involvement is 0 to 1, that first year of life, more than double any other age of life. And that's largely because of poverty-related issues, be it neglect or abuse. We take kids out of their home, and we as a society have to pay for foster care until they're 18. Wouldn't it be better, like Brian said, to prevent that, to make sure kids can stay in their home, that they have the resources they need to make sure that they're thriving? So that's the story of baby Audrina. So ARC's Kids kind of was created as this kind of vision to make sure that families have what they need in this critical time-limited window. So it's laser focused on pregnant mamas and babies. So if you look on the second page of this packet and this graph, that dip in income is right when a baby's born. So it turns out families are poorest. The greatest economic shock in a person's life is when they're pregnant and about to have a baby. Babies are expensive. If anybody's had a child here, babies need a lot of stuff. Diapers and cribs and car seats and, pack and plays, the strollers, the list goes on and on of what babies need. And this is coupled with a drop in income. So moms often towards the end of pregnancy come out of the workforce. We have no paid leave policies in this country. So it creates this perfect storm for economic vulnerability. Once again, this is the poorest time in people's lives is when they are having a baby. And when I first heard that as a pediatrician, I was like mind blown because like this window of life is so important. Your brain literally doubles in size in this window. If we can buffer families and children from adversity in just this time-limited period, it pays dividends off in terms of the life course. There's an article I cite on page 5 from the Quarterly Journal of Economics. Just a $1,000 investment in this first year of life reaps dividends, greater economic productivity 30 years later. So we know that investing in early childhood, we know that what happens in this window improves health, improves economic productivity, has these life course benefits. So that's why ARCS Kids is a short program. It is laser focused, once again, on moms and babies when families are the poorest, when expenses rise. On page 3 is a little bit kind of more about how the program is run. It is a public-private partnership. So we've been able to leverage TANF dollars from the state of Michigan. TANF, as you know, is a Temporary Assistance for Needy Families program. It is a federal state block grant that was designed to provide temporary assistance for needy families. And this is exactly what this is. We are using a provision in TANF called non-recurring short-term benefits, or NRSTs, which allows you to give just 4 months of cash support during an acute episode of need. We shared with the state and the federal government that pregnancy, childbirth is the greatest economic need in the life course, and they agreed. So we're allowed to give 4 months of cash support from TANF for just the first 4 kind of cash prescriptions of ARCS Kids. On page 3, that's denoted by the green. So the first $1,500 pregnancy cash prescription and the first 3 infant cash prescriptions are from TANF, but only for low-income families, because TANF can only be given to low-income families. And then thanks to philanthropy and other funding sources, we can make this a universal program for a poor community and extend it for as long as possible. When we have philanthropy involved, when it remains a public-private partnership, we're also able to protect other public benefits. So these cash prescriptions don't count as income, and it doesn't impact folks' eligibility for important things like Medicaid and SNAP and WIC and different things. So that's the kind of the design of the program. It is a plug-and-play program. We built this in Flint because of kind of the early success of it in 2024. The governor's executive budget included more TANF money to expand this to other communities in our state. So we started in Flint, but this year we are now in the city of Kalamazoo. We are in 5 counties in the eastern Upper Peninsula of Michigan. Rural poverty has added challenges, difficulty accessing health care, transportation issues, not as many kind of social services and different nonprofits up in rural communities. So we are seamlessly live up in 5 counties in the eastern UP. We went live in the city of Pontiac in the beginning of May. We're about to go live in other communities in Wayne County, and then there's a few more communities online, including Clare County, which is the 3rd poorest county in the state of Michigan. There's a lot of interest from Ypsilanti and Saginaw, so lots of excitement about ARCS Kids throughout the state. So it's plug and play. It's a super efficient program. There's no overhead. There's no bureaucracy. There's very minimal staff. It's a low-touch program. We leverage technology. Families enroll on their phones. They can upload verification of residency and pregnancy and childbirth, and then by and large, cash is delivered via direct deposit to folks' checking account. So very, very low staff, low bureaucracy. Actually, these kinds of cash transfers were championed in the 1940s by libertarians who were fans of kind of small government. There's not a lot of bureaucracy in this kind of program, which is what makes it so efficient. So that's a little bit about how the program is run. Our evidence to date, which is kind of summarized in page 4, is pretty awesome and not unexpected. Child cash transfers are common around the world. 70% of countries do this. We did this as a nation during COVID when we expanded the child tax credit. So in 2021, almost all families with kids got monthly cash, unconditional cash. We dropped child poverty to the lowest level ever, and with that, lots of outcomes improved. That was not renewed by the U.S. Senate. So because of that, a lot of the states have adopted their own child tax credits. About a dozen states now have their own state-level child tax credits. So you can think of ARCS Kids as a tiny version of that because it's just for pregnant mamas and babies. So the evidence that we have is pretty phenomenal, and once again, consistent with national and global evidence. Huge improvements in family financial security. So we were able to improve housing stability. We had no evictions last year in our low-income mamas. That's amazing. Families were able to stay in their house and afford paying rent and had less back-owed rent. We had improved nutrition security, improved maternal mental health, a significant decrease in postpartum depression, improved maternal well-being. Our mamas felt more loved and more empowered and more respected. In big data, because we have full saturation, everybody who is eligible for this program is enrolled in this program, which is pretty amazing. We have a 100% take-up rate. If you think about things like WIC and home visiting programs, that those take-up rates range between 20 and 50%. So we can look at the big state-level administrative data. We have improved prenatal care, so a massive increase in mamas going to prenatal care. They're coming to prenatal care earlier. They're coming in the first trimester. We have less smoking in the third trimester, which is incredible. We have improvements in birth weight, improvements in gestational age. We had less NICU, less costly NICU admissions, which is also phenomenal. And then touching on kind of the beginning of my presentation, using state data, we actually have a decrease in child welfare allegations. So because of this program, we had less complaints, less investigations due to child abuse, due to child neglect. That is saving all of us a lot of money. And then we just had a report that came out last week from the Flint Chamber that also talks about the economic development of a program like this. So the Flint Chamber shared that a program like this has about a 1.57 kind of return on investment. So every dollar spent on this program, another $1.50 comes back to the community because these dollars get spent locally and they're revitalizing our local economies, going to grocery stores, supporting small businesses, paying for landlords. So this is also an economic development tool. On page 5, we actually can kind of start to map out and model the economic savings to the state. So just in Flint, because we've been able to prevent NICU admissions, prevent preterm births, prevent low birth weight babies, we were already saving millions of dollars. If you map it out to the state, just those two things, and we have many, many more outcomes, would save the state about $500 million. And that doesn't even count the savings to child welfare, to maternal health, to the economic development. So this is something that will also save our state a lot of money. The next page kind of shows our expansion. We're once again touching all corners of our great state. Once again, there is not a day that goes by when I don't hear from folks across the state saying, hey, we want this too. This is evidence-based. This is so efficient. Our families are struggling. They're struggling with affording all these really essential things that they need. And this is kind of that most critical moment. I think I will stop talking, and I look forward to your questions. We're really excited that $20 million was included as a kind of continuation of this work, but we're also really excited to continue expanding this efficient, evidence-based program throughout our state for mamas, for families, for entire communities. Thank you.
Thank you for your testimony. We appreciate it. So you said you have data on showing who's eligible for this program. Do you reach out to them?
That's a great question. So it's just been incredible that we've had to do very little marketing and communications, and people find out about the program. So in Flint and now in Kalamazoo and in the Eastern Upper Peninsula, we are at pretty close to 100% take-up rate. And we're able to verify this using birth certificate data. So we get data from the state of Michigan about all the births in a community, and we match that with people in the program, and it's about 100%. The most common ways people find out about the program are word of mouth and social media. So when you design something that is of value, that is simple, that also conveys messages of like dignity and deservingness and trust. I think it's unlike a lot of our other kind of programs, which are very stigmatized. So families kind of are excited about it and are willing to sign up. So once again, this is most of my career, my professional life has been trying to find hard to reach people. Like, why aren't folks signing up for something? And it is different for this kind of program because of the simplicity, because of the efficiency, and because of the value that folks see in this program.
Okay, we have some other questions for you, Rep. Wolford.
Thank you, Madam Chair. Appreciate you. Thank you for being here today.
Thank you.
What is your, you had mentioned that you have low overhead and not a lot of employees. What is your annual budget that you have?
Yeah, so we've raised about $105 million in the last 2 years for this program in Flint and for this program now in the expansion communities. If you look on page 7, that's where all the money has come from. It's all come from, it's public and private dollars, the TANF dollars, and then other dollars from other municipalities. For example, the city of Kalamazoo, the county of Kalamazoo, the city of Ypsilanti just committed $100,000 to get this there. And then lots of the majority of the money, the rest of the money, about 70% of the other funds come from philanthropy. So that is kind of the pot of money that we have for this program. Our overhead does not exceed, I would say, 15%. Most of the money does come to Michigan State University, where I work, and there's also, a very, very kind of small amount that comes for the operations of this program. The administration of this program is done by an international leader in cash transfers. We didn't want to reinvent the wheel. We didn't want to do something that we didn't know how to do. So the folks that actually administer this program is an organization called Give Directly. All they do is very efficiently get people their cash. So working with them has also made this super, super efficient and has enabled us to scale in this really kind of plug and play model without any added costs.
So, and I'm sure it's somewhere in this brochure, but it shows that you've helped 1,600 families with more than $7.5 million in cash. So has that laid out the difference of the $100 million that you bring in versus what goes out?
Yeah, so we're actually up to $10 million that we've prescribed. So $10 million has gone directly in the hands of moms and families into our communities. And the rest of the money that has been raised is for other communities that haven't, we have cash on hand to be able to deliver the money for other communities for future years.
What is that cash on hand that you have?
Well, most everything is invoiced, so we actually don't have the cash on hand. So we invoice the state, we invoice kind of different philanthropy. So we're not sitting on money by and large.
Okay, so I'm sorry. So you've raised $100 million.
We have commitments of $100 million. We don't actually have the money, not all that money.
So what do we have?
I don't know exactly how much is in the bank, so I don't know.
Okay, well, that's probably important to know. If you're giving money out, you should probably know what you have in your account.
Absolutely, but we absolutely have the commitments in place to do this in all these communities for 2 years.
Okay, and then the other question I have is, how does this differ from the other 6 programs that we have through DHHS? And there's a plethora of help there. So how do those work together? How are they different?
Sure, that's a great question. So what kind of other programs are you talking about?
Well, there's 6 different programs on DHHS that you can sign up for when you're in need. So the question is, how do you if you're you're asking for state money, you have people that give. How does it? I just see a lot of. I'm learning and seeing what appears to be, and I don't know this for sure, and this is why I'm asking the question. A lot of duplication of programs that already exist with hundreds of millions of dollars put there, or in state and local affairs, $30 billion. So I guess how do you differ yourself from that, and why would I? Yeah. I think
that's a great question. So I think there's a lot of things that make this unique and different from anything that we have. I think the first is that it is a public-private partnership. So it's not something that's entirely kind of government supported. And then I think the biggest difference is that this is so, once again, laser focused on moms and babies. There's not another program that provides economic stability just for this time-limited window. So there's other kind of support services like WIC, that's just for nutrition. There's childcare support, but that's just for childcare. There's SNAP, which is food assistance. There's TANF, regular TANF, but only a tiny portion of families are eligible for TANF. So this is something that, once again, is laser-focused on moms and babies. It is a universal program for poor communities. So this is something that's everybody in an eligible community can participate in. And once again, it's a public-private partnership.
And the $500 monthly stipend, how long can they be on on that?
So it depends on the community and how much we're able to raise. So in Flint and Kalamazoo, it's prenatal, and then it's up till 12 months of age. So it ends at year 1. But in all the other communities, based on how much we're able to raise, it ends at 6 months of age. So I wish we could go longer, like most other countries, do some sort of child cash allowances until 18 years of age. But this ends for many places at 6 months of age, which gets them through that economic shock of pregnancy and the first few months of life.
Okay, thank you, ma'am.
You bet.
Representative Song.
Thank you, Madam Chair. Thank you so much for this presentation. As a mother of 4 young children, I can certainly appreciate this program, and I know how much it costs to raise children. Mine are very close in age, so I had them almost every other year, and not being able to work, I can certainly appreciate getting that cash assistance. Overall, we have a population issue. A lot of women are not able to have children because they can't afford them, so I can appreciate a program like this that will help to incentivize families to continue to grow their family. Now, my question is, and I'm really glad to hear that you guys are expanding, but are there any concerns about some of the potential federal cuts to the TANF program and some of the work requirements that will come along with these public dollars?
So let me kind of just comment on your first point. So we do have a population issue. And we were so excited to hear that President Trump was championing a baby bonus, $5,000 baby bonus to support families to have more children. And early data that we've actually already seen in Flint is that we actually, after a 20-plus year decline, increased the birth rate. And we have more births to older moms, 30 to 39-year-olds, higher income moms, and more educated moms, and first-time moms. There's a lot. We're still kind of teasing out why, but this is something that a lot of other countries are doing to make sure that they can increase their birth rate, and we're excited to see that kind of bipartisan support. We have no idea what's going to happen at the federal level. So there are talks about kind of cuts to TANF or a decrease in the percentage that the states get TANF. And the provision that we are using, the NRST provision, the non-recurring short-term benefits, which allows, once again, the 4 months of cash during an acute episode of need, which we've defined as pregnancy and childbirth. That provision allows for an exemption of work limits and work requirements and lifetime limits. So I don't think that will be part of it, but we have no idea what will happen at the federal level. And budgets are tighter by and large all over because of cuts in federal funding.
Representative Young.
Thank you, Doctor, for being here. I think about this program and how we talk about that prenatal time and the period. I was in Detroit. There's a program called Sister Friend.
Yes, I know.
I was a sister friend.
Yes.
And I journeyed with my little sister through her pregnancy and up to that first year of life, which helps really ensure that the baby has a good start, the family has a good start. So I get this time period. Well, I'm trying to understand. I was trying to figure it out in your information. So how do you qualify for the 6 months or the 12-month program? I'm not clear about that.
Yeah, so it's really based on how much money we're able to raise. So we have some of the state dollars, but we have to raise about 70% more than that to make it possible in a community. So for example, in Kalamazoo, we had to raise another $5 million a year. So the city of Kalamazoo raised, the community champions over there raised about another $10 million, and that was enough to do the 12-month program. In the Upper Peninsula, where there's great need, there's not a lot of, the Kalamazoo, the day after the budget passed last year, the Stryker Foundation in Kalamazoo said, we're giving $5 million for this program. That was amazing. They saw the state come in, they're like, we're going to come in. But to do this in the Eastern UP, there's no place-based foundations. There's not a lot of philanthropy up there. But we knew it was so important to do this in our rural communities. We wanted to make sure that we did this kind of throughout our great state. So a lot of the money that we raised in the UP came from outside of Michigan. The Bezos Family Foundation, the Amazon people committed a $1.5 million for the Upper Peninsula. Another foundation in Washington State gave us almost as much because they care about rural health and indigenous health. And we raised another $4 million just for the UP, and that allowed us to do it for 6 months. So the duration of the program depends right now how it's structured on how much more money that we are able to raise to make it possible.
Representative Wozniak, and hopefully the mic will settle down a bit there.
something's in the air.
Yes.
Hopefully, these are just mundane questions. Is there a limitation on alcohol and smoking purchases?
No, but in our data, and in national data, a program like this decreases substance use. So already we're seeing a decrease in smoking in pregnancy with big data, a significant decrease in smoking in pregnancy, which is one of the mechanisms why we have improvements in birth weight. Because when you smoke in pregnancy, your babies are smaller. We're already seeing that income. The city of Pontiac committed $500,000 to this program using opioid settlement dollars because they know that a program like this is going to prevent substance abuse, which is also seen in the literature. So we anticipate in our data, and we'll continue seeing decreases in all kinds of substance use.
Is there a delineation between single parent and dual parent money?
Yeah, so the money for the prenatal cash prescription goes to the mama, but once the baby's born, it stays with the baby. So if there's an issue with custody or dads or grandparents or whatever, it stays with the baby. So right now it just goes to the pregnancy is the mama, then follows the baby, whoever is the caretaker of that baby.
Okay, two more, real quick. Any limitation on the number of kids, or can I have 20 kids?
Yeah. So the neat thing is that we've seen lots of twin pregnancies, and actually when you have more economic stability, you have a greater likelihood of twins. So I'm not sure if you're familiar. Alaska has something called the Alaska Permanent Fund, where they have oil revenue, and they then give families the money from the oil revenue every year. And depending on how much money families get every year, you actually see increases in twins based on that because of the stability. Anyways, so we have so if we've had twins. And it's only one, the $1,500 for pregnancy. The moms get the same amount of money, but when it's a baby's born, it's $500 for each baby that is born if it's a multiple gestation, because they all have car seats and strollers. The number one expense that our mamas spend this money on is diapers. So baby supplies, diapers is the number one thing that people spend this money on. Then it's rent, transportation, utilities, food. And if families have another child and the program is still there, they absolutely still qualify.
Last question is, I'm sure, I'm dealing with a blank slate here, but for our area, Midwest, are there other programs in other states, or are you seeing an influx of people coming to your program?
These are great questions. So I shared how we had more babies born in Flint last year. This is amazing. The mayor was so excited that we had more babies. So we're trying to tease out, do we think people move to Flint to be part of this program? I was in Saginaw about a year ago, and an OB was she told her patients, she's like, you should move to Flint. You will be better supported if you move to Flint. So we're trying to see if there was migration. Did people move to a community, or did people stop leaving Flint? Because we've had bleeding, population loss. But it doesn't look like migration is the full part of the story. When you give pregnant mamas cash, and this is also based on evidence, they're less likely to have a miscarriage because they have more resources to carry a baby to term. There's also evidence that when families have a little bit of financial support, they're also less likely to have an abortion. The number one reason to have an abortion is the cost of having a baby. So we think those are at play as well. And then also we think that families just decided to have a baby. We think it is that natality fertility issue. I feel supported. I'm going to decide to have a baby in this community right now. And that kind of plays out because it's more births by older moms, first-time moms, and more educated moms. So we don't think there's as much of the moving, but we are following that data. Great questions.
Thank you. We'll go to Rep. Thompson. If anybody has a cell phone by the microphone, that could be causing the problem too. So, okay.
Thank you so much for all the work you do. Thank you, Madam Chair. I was just trying to follow the temporary assistance for needy families. So is it accurate that a mom can get this financial assistance through your program, through the prescription, but also qualify at the state level for that?
Yeah, so this provision, the NRSD provision, it enables you to be on TANF and still get this. There's, I don't know what the exact number is, but I think a very small percentage of families actually get cash transfers from TANF. So before RX Kids was in the state, only 6% of TANF dollars was actually going to cash assistance.
So if they were applying through, because when you do, I think what Representative Wolford was trying to attempt to get at is when you apply for benefits, you can apply for Medicaid, you can apply for food stamps, the emergency for utilities, and then even not even going to the WIC, but staying with the temporary assistance for needy families, which is the cash. So you were finding that families weren't utilizing going for the government assistance. They weren't applying for these benefits.
Well,
so you guys were actually able to apply for the benefits technically on their behalf through the state of Michigan, or how did that work?
So there's a lot of folks that are eligible for programs, that government programs, that don't sign up because it's complicated, it's bureaucratic, and by and large they think they don't qualify. It's also stigmatizing. They need lots of forms, and people on benefits don't want to be on benefits. So that is why a lot of the take-up rates for just regular TANF, for WIC, and for many of these programs are lower than they should be. Like WIC is a great nutrition program for pregnant moms and kids. It only has a 50% take-up rate in the state of Michigan, and folks don't know they're eligible or don't sign up for whatever reason. So we were able to leverage the TANF dollars, blend it, weave it with these other funds to deliver this program. On the back end, we figure out who to bill for. So folks can still be on TANF and receive this. However, there's not that many families on TANF to this day.
I gotta say, it sounds great. I mean, I'm thinking about, there was a time period in my life where I was a divorced single mom of 3 kids, and I was going through nursing school, and I would have just thought, wow, if I had this program, I could have got all that money, and I wouldn't have to waitress at night.
It's
I
hard.
wouldn't have had to. Dad took off, didn't pay any child support.
So hard.
He wasn't responsible for taking care of the kids, still hasn't paid a dime of child support. How are we holding those men accountable that aren't participating in that life of that kid?
Yeah, it's not part of this program, but
I was going to say, not
but
part
something,
of this program.
but you almost, I was tearful. Like, these are the stories we hear from our families all the time. Like, I can breathe. Like, a weight's been lifted off my shoulder. I can go back to school. I can pay for.
I was going to, just one more question, and then I will close out. You've only been operating since 2024?
Right, January 2024.
Okay, so about a year.
A year and a half. Yeah.
Is there any moms that have went to school, gained employment, or was able to
absolutely.
to utilize this money to better her life, opposed to just staying on this money?
So many got their GED, got their nursing degree, was able to pay tuition. So a lot of that is about bettering themselves and bettering their family. And the dads are so excited and involved. I kind of, this is something for the whole family. We actually have a research effort this summer looking at how this is impacting fatherhood and how impacting kind of the role of the dad in the child's life as well.
Oh, is there any requirement to be a U.S. citizen?
No, there's not, but no government money is supporting anybody.
So
who's
the
not a user.
TANF money that's you have to be a U.S. citizen
Yes,
to get.
Absolutely.
You guys just
and
don't use
we've
that
worked
money. You
very
only,
closely with the state.
You only use the philanthropy money
covers everybody
for the
else.
illegal immigrants. Okay, thanks.
So I have one question. Besides the monetary funding that you give to these mothers, is there educational materials too?
So that's a great question. So if you go on our website, rxkids.org, we work with every community for all the other resources that our communities offer, all the wonderful other wraparound services that our families offer. So they're pushed to that often. We also have lots of other special events. We do baby parades in every community. We just had a baby parade in Pontiac. I'm inviting you all to the next baby parade. Baby parade started in 1918 during the Children's Year by settlement house women who said, we need to do better on behalf of moms and babies. That's what spurred the National Children's Bureau. So in this very kind of patriotic display, we have baby parades. Once again, we just had one in Pontiac with American flags, and really kind of celebrating our moms and our families and our babies, and how a community can kind of come alongside everybody to support folks during this critical year. So it's during those events that we also share resources with families.
That's great. Baby parades sound fun.
You're all invited to the next baby parade.
Representative Burns.
Thank you, Chair. Thank you so much for being here today, and thank you for all the amazing work you're doing with RX Kids. It's really outstanding. So my curiosity and my question is really around kind of long-term tracking. It sounds like, obviously RX Kids is a relatively new program, and already you're seeing really positive results for folks during their time formally enrolled in the program. But is there a plan, or do you have thoughts as to how you might track kind of long-term outcomes for the parents and the babies also
Absolutely.
involved?
So I am an academic, so research is what we do. So we have separate funding for research from either kind of philanthropy or different things, which really supports a lot of these different evaluation efforts. So we do program evaluation, but we do hardcore research where we're comparing our impact to other communities across the state and to the state as a whole. So we do have efforts to do longitudinal research. We are launching another maternal survey this summer, which includes graduates of this program. And I anticipate seeing, consistent with a lot of the other data, that when you invest in early childhood, it has a massive return on investment. Spending money now will once again save less money in child welfare. We'll have improvements. People spend more money on enrichments and books and childcare and nutrition. All these things will improve, for example, kindergarten readiness and third grade reaving and less chronic disease. Like the list goes on and on and on. So yes, we do have plans, if we have sufficient funding, to do that longitudinal research, and we expect our data to be consistent with other national data. Some of the great research about similar programs actually comes from our Native American communities, where they do capitation payments and they follow children over time, and kids who receive these kinds of payments do much better later on in life.
Awesome. Thank you so
Yes,
much.
it'd be great to see that data when
Yes.
you get that. That would
Yep.
be wonderful. Well, you're known as Dr. Mona to everybody, so thank you, Dr. Mona.
Thank you,
for
Representative
coming here
Schmaltz.
and
Thank you.
testifying. We really appreciate
you.
it. And please let us know the next baby parade.
I will. Thank you all of you for your steadfast support for our families and especially our little ones. Thank you.
Rep. Thompson moves to excuse absent members without objection, so ordered. Thank you. There being no further business before the committee will now stand adjourned.